What's up everybody, Tim Rementer, Doctor of Physical Therapy and Orthopedic Specialist. As we talked about in our last video, low back pain is not a diagnosis. Rather, it comes down to a variety of movement-related issues. This is precisely why Googling low back pain exercises is a true roll of the dice.
Doing these exercises without proper instruction or evaluation, you can risk injury or worsening of your pain, which is precisely why you should reach out to your movement specialist if you're at the point of needing help.
Okay, let's go ahead and click on our first link here because that's the typical practice. And it brings us to this 11 exercises for low back pain relief. One thing that jumps out is there's no author. There's just somebody who reviewed the article who happens to be a microbiologist. I don't know why this is the first thing they talk about. I've never prescribed this exercise for back pain in 17 years of clinical practice. Of course, we need to bend over in life, but keep watching till later in the video to learn a safe way to do so. In the meantime, of course, don't do toe touches for an exercise. We can agree on that. Next on the list of exercises to avoid are leg lifts and sit-ups. I'm not sure what's older, the exercises themselves or the stock photos used to describe them. Getting into the exercises they are recommending, partial crunches and pelvic tilts. These both focus on the superficial abs or the front of your core. Your core is so important because it controls an otherwise vulnerable area. Let's first get into exactly what makes up your core. All right, so let's talk abs. Your core is more than your abdominals. Your core, think of it like a cylinder. You have a ceiling, a floor, and walls all around. Your pelvic floor makes up your floor of your core. Your diaphragm, which is your breathing muscle, is on the ceiling. And then around the walls, you have your back extensor muscles, you have your obliques, and then in the front you have your abdominals, most importantly your transverse abdominis. When you start doing things like curls and partial sit-ups, you're using the muscles closer to the skin rather than the deep muscles, which need to be working properly and first in order to have safe pain-free movement.
How do we correctly go through core work? We're going to start with the ceiling, which is your diaphragm. So here we're doing diaphragmatic breathing. We don't want to use the upper breathing muscles in the chest, so I'm feeling to make sure my chest stays quiet. And you can see my stomach was rising and falling. That was an example of a bad repetition. Here's a good repetition. Stomach rises, stomach drops. This is going to be your easiest position to start with this exercise. Try to make it more difficult by doing it in sitting and in standing. Next is to work the deep layer of abdominals on the front. You can feel that bony part of your hip right where I'm poking, and then just drop your finger inside toward your belly button. You're trying to draw your stomach down like you're squeezing into a tight pair of pants. You'll feel that muscle get tight. At the same time, the upper abdominals should stay relaxed. So if you poke up on your six-pack muscles, they should stay soft while the lower ones tighten. Once you've mastered your deep abdominal work, you can move on to superficial abdominal work with the pelvic tilt. You can start here on your back and then progress to sitting and finally in standing. Next, let's talk about your hamstrings. Your hamstrings run on the back of your thigh and attach below your knee. They're important for back pain because they also attach under the bottom of your pelvis at your butt bone. Its flexibility can change your ability to move correctly.
What also runs on the back of your thigh is your sciatic nerve. If you're having any kind of irritation shooting down your leg, you want to make sure that any type of stretching is directed to the hamstring only and not into the sciatic nerve. That's why when we do this exercise, we like to see it done actively. So lying on your back, like you can see here, you have the knee bent 90 degrees, and then you're trying to straighten it as much as you can, keeping the ankle relaxed. We don't want to pull the ankle toes to the nose. We certainly don't want to pull on the ankle with a strap because that's going to exert a much stronger force on the nerve.
You want to make sure a stretch is felt behind the thigh and not behind the knee. That would tell you that you're stretching your nerve and not the muscle. Next on the list is wall sits. Most people are already overusing their quads, so unless you know how to really activate your glutes exclusively with this exercise, I would just go ahead and skip it. Next up on the list is bridging.
When we do bridging, we want to make sure that we're targeting our back, our glutes, and our hamstrings, and not relying excessively on our quads on the front of the thighs. When you have your feet flat, that puts more of the pressure on your quads and your knees, and that's one thing the picture actually showed correctly was the weight on the heels. Okay, so if you look here when we're doing the exercise properly, we have our weight on our heels. If you want to have your feet flat, you can. Just make sure all your weight's pushing through the heels. The further away from your body you put your feet, the more emphasis goes to the hips and the less to the knees as well. Also makes it more difficult. Okay, one thing you can do if you have any kind of back discomfort when you're bridging is try to tighten your glute muscles more. That will put more of the emphasis on the glutes, less on the back extensor muscles. That usually is quite helpful for patients. Okay, next up, knee to chest. This can be hugely beneficial if you have any type of hip restriction. If you don't have good hip mobility, when you bend forward, the emphasis is going to go to your back rather than in your hips where it should be. That's why we talked about the importance of hip hinging in our last video to eliminate back pain. The more your hips can move, the less your back has to. When you're doing the knee to chest exercise, you want to gradually bring your knee toward your chest, pulling with your hands on top of your knee or under your knee, whichever is more comfortable. Don't cause any pain in the groin area, and you can bring the direction toward your shoulder of the same side. Try to bring it across your chest to the opposite side, provided you don't have any discomfort.
The problem with this picture and description is that they're actively bringing their knee to their chest, which essentially makes it another abdominal exercise rather than a stretch. It wasn't in the list, but we need to talk about Supermans. The problem is with chronic pain, research shows us that the deep back muscles become a little bit sleepy. When we do this exercise, we're just basically pulling them along for the ride and they don't have a chance to activate. A better alternative would be to use hip extension exercise from your stomach. It's much slower and you can control the movement. If we want to work from the top down, we go back to our hip hinge that we talked about in the last video. Keep that arch throughout and initiate the movement with your glutes. Now some of you might be saying to yourself, Tim, you just got done telling us not to do toe touches, and then you're showing us hip hinges, which is basically a toe touch. The difference is you're using the correct muscles on the back of the body, namely your glutes, back extensors, and hamstrings, as opposed to putting a lot of stress on your discs and ligaments in the toe touches.
Bird dog is a little bit more advanced and focuses on stabilization of the spine. It can be difficult for people who are in a lot of pain, but done properly, you want to start off by just doing the leg, not incorporating the arm as well. It's much more difficult. If you can't keep your lower back flat when you're doing it, then you know you don't have the stability to move on to more difficult versions. You can place a rolled up towel on your back to try to see how well you can keep it stable. Okay, next up is prone on elbows or elbow presses. This is usually helpful in many cases because most of what we do, as mentioned in our first video, is in front of us. So getting our spine to arch backward usually takes pressure off discs and things of that nature in the back part of the spine. Of course, any kind of discomfort doing this, any radiating down your leg, any pain of any type, you should reach out to your movement specialist for an appropriate diagnosis. Next, they talk about aerobic exercise, which is tremendous for any problem in our body because it increases oxygen delivery. Whether you're walking, swimming, jogging, it doesn't matter as long as it's not producing pain and you can sustain it for life. They go on to talk about strength training and Pilates, but don't really offer any specific advice for an exercise to do for either.
Let's briefly click on the next link, which is WebMD, to see what they have to offer. Avoid toe touches, partial crunches, sit-ups. This is the exact same article.
Next time you have pain, remember before you jump on Google that there's a movement-related issue at the foundation and that you need a movement specialist to help you get to the bottom of your problem. Join the movement by liking, subscribing, and turning on notifications so you never miss a future video. If you want to feel, perform, and live your best, you've got to move your best. Keep it moving.